So we're always hearing about AI, right? But have you ever stopped to think if it could actually make a hospital stay, well, better? A new study dug into that exact question, and the answer is pretty fascinating.
I mean, think about it. AI is everywhere. It's in our phones, our cars, how we shop. But what happens when you take that same tech and put it in a hospital? Suddenly, the stakes are way, way higher. So let's get into it. It's easy to get lost in all the hype. So some researchers decided to cut through the noise. They published this really interesting study, basically trying to connect the dots. Does a hospital being good with AI mean its patients are actually happier? That's the big question they wanted to answer.
All right, Section 1, AI enters the hospital. So, first things first, what was the study even trying to figure out?
The main goal was pretty simple, but also really important. They wanted to know if a hospital's AI capability, basically how good they are at using this stuff, could actually improve patient satisfaction. Can better tech really make for a better, less stressful experience for you? That's what they wanted to find out.
Okay, Section 2 is all about the two key AI tools. See, AI capability is kind of vague, right? So the researchers had to narrow it down. They focused on two specific types of AI that are really making a splash in the medical world.
And to make this super easy to follow, let's give them some cool nicknames. Think of one as the data detective and the other as the digital consultant. They do different things, but both are absolutely crucial.
So let's break these down. First up, our data detective. This is what we call machine learning. Imagine an AI that can sift through millions of patient records and lab results in seconds, looking for tiny patterns the human might miss. It's all about finding those hidden clues in the data. Then you've got the digital consultant, or expert systems. This is more like having a super specialist looking over your doctor's shoulder, offering advice on a really tricky diagnosis. And here's the key thing to remember. Both of these are tools to help doctors, not to replace them. Think of them as power-ups for our medical pros.
All right, Section 3, the surprising connection. So we've met our two AI players, the detective and the consultant. Now for the really cool part, what did the study actually find? And how did they even measure this stuff? Well, they went straight to the source. These surveyed 257 medical staff members in Saudi Arabia. We're talking about the doctors, the nurses, the technicians, the people who are actually on the ground using these AI systems day in and day out. And this is where their method gets really smart. Instead of asking patients, who might not even know AI was involved, they asked the medical staff. Why? Because the staff sees the effect of the AI. They're the ones who can actually say, hey, this tool helped me catch something I might have missed. They have the inside scoop. So, the big question. After talking to all those people and crunching the numbers, what was the verdict? Does a hospital that's good with AI actually have happier patients? The answer was a huge, clear yes. I mean, just look at this chart. Both of our AI tools, the machine learning detective and the expert system consultant, showed a major positive link to patient satisfaction. You can see the bar for machine learning is a little bit higher, but honestly, the big story here is that they both work. They both make a real, measurable difference. Okay, that's awesome. We know it works, but how? Like, what is actually happening behind the scenes that makes a patient's experience better? How does an algorithm translate into better care? Well, the study broke it down into 4 key areas. The medical staff said that using these AI tools led to fewer medical errors, which is, absolutely massive for patient safety. It also helped bring down medical costs, it boosted the overall quality of medical services, and, get this, it actually decreased waiting times, which is something I think we can all get behind. So we're not talking about fuzzy feelings here. These are real, concrete improvements. All right, last section, Section 4, why this matters for you. Let's pull the camera back for a second, because this is bigger than just one study. What does this really mean for the future of healthcare for all of us? Now, you might be thinking, okay, but that study was in Saudi Arabia. And you're right, it was. But the takeaway here is totally universal. This is some of the first hard evidence that shows that when you give hospitals the right tech and you train people to use it properly, it's not just some fancy expense. It's a direct investment in better, safer, and more efficient healthcare for everyone. It really boils down to this simple 3-step process. Step 1, a hospital decides to adopt these advanced AI tools. Step 2, the medical staff uses those tools to make better decisions and speed things up. And step 3, the result of all that, you, the patient, get higher quality care and have a better, more satisfying experience. It's a clear chain reaction.
And if there is one thing you take away from all this, let it be this. AI is not about replacing doctors and nurses. Not at all. It's about empowering them. It's like giving a master craft person an amazing new tool. It just lets them do their incredible job even better.
Which kind of leaves us with a really interesting final thought, doesn't it? As AI gets better and better at crunching the data and helping with diagnostics, what's the most important job left for the humans in healthcare? Maybe it frees them up to focus on the things that AI can't do: empathy, communication, and that human touch. And maybe that's the real game changer.